Hello, this is the second video of Dr. Pinky's mental health video series. These videos are designed to give medical students an introduction to basic mental health assessment. This video will have how to ask patients about any ideas of suicide they may have. Asking questions about suicide can be a very difficult task for both you and the patient, but hopefully after using this and the other resources, you will have a better idea of how to perform this task. This video will not contain everything you need to know, but it will hopefully help you with where to start with this difficult topic. You should ask all patients who have moderate or severe mental illness about suicidal ideas. The attitude of a patient presenting in this way can vary greatly, and it is important to remember that. As well as having a good idea of the questions you want to ask, also tailor your approach to best suit the patient you have in front of you. In most cases, questions about suicidal ideas will follow on from the depression history which hopefully you saw in the previous video. You did watch the previous video, didn't you? At this point in your medical education, you are not expected to be able to carry out full suicide risk assessments but have an understanding of the questions that should be asked and how to ask them. The best advice is that these sort of assessments are thorough, but do not seem invasive or judging to the patient. Use phrases like, "Other patients in your position may feel like this." This can help the patient to be more open about how they feel. Another good technique is to ask a series of questions that get a bit more information each time, and give the patient the confidence to answer honestly. It is not a good idea to ask, "Are you going to kill yourself?" straight away. Remember, asking about ideas of suicide does not increase the risk that the patient will try and commit suicide. So with this in mind, let's have a talk with our patient today. Hello, my name is Dr. Pinky. Can I check your name and date of birth?
Hello. My name is Mrs. Snuffles and my date of birth is the 10th of May 1985.
I have been told you have been feeling down recently and that you have lost interest in doing things. Is it okay if I ask you some more questions about how you are feeling?
I suppose that would be okay.
Okay, thank you. I understand that you've been depressed for some time. Some people who are depressed feel life isn't worth living. Have you ever felt like your life is not worth living?
I guess at some points, I've thought that might just be easier.
Okay, have you ever felt like you wished you could die?
Yes. Maybe when I've felt really low.
Have you thought of any ways in which you could end your life?
Not really, but I guess I have. Lots of pills at home, if I ever decided to.
Okay, I see. Are you planning to end it all?
No, not at the moment.
Have you ever tried to end it all in the past, or tried to harm yourself at all?
No, I've never tried to do that before.
So we can see here, although we have not fully assessed the risk for the patient, we have gained some very important information. They have thought about suicide and have the means to do so, but they do not plan to kill themselves now. It is important to ask if they have felt like they want to die, if they have thought about how they would do it, and if they are actually planning to commit suicide. However, there is more information needed. You must find out if the patient has had previous history of attempted suicide or self-harm, as this indicates an increased risk of further attempts. Also ask if any friends or family have committed suicide in the past. You should also screen for underlying mental illness.
At the end of each assessment, you should have an idea of how likely it is that the patient might commit suicide. Remember the questions to ask. The questions asked by Dr. Pinky show the stages of progress a patient goes through when contemplating harming themselves. The further along this process the patient is, the more likely the possibility of suicide.
Thank you for watching this video. We hope you found it helpful and that you check out the next 2 videos in Dr. Pinky's series. Remember to use other resources along with these videos to build on what you have learned today. Thank you and goodbye for now.